I'm George Foussias. I am the director of the Slate Family Center for Youth in Transition and the chief of the Schizophrenia Division here at CAMH. And I'm one of the people responsible for bringing Navigate and implementing it in the Slate Center as our model of care for youth experiencing early psychosis. I'm also one of the lead investigators on a study that is looking at the implementation of Navigate as the model of care for early psychosis in other centers across the province. So Navigate is an evidence-based package of care for the treatment of early psychosis that emerged in the United States from a funding initiative from the National Institute of Mental Health that was designed specifically to develop comprehensive specialty care for individuals experiencing a first episode of psychosis. It was then evaluated in the context of a randomized clinical trial and demonstrated superior benefits when it comes to things like functioning, quality of life, treatment engagement, and symptom improvement relative to treatment as usual. So there's a number of individuals that are part of the Navigate team. It starts with the director, who coordinates the functioning of the team and ensures that all patients and their families are connected with each of the other members of the Navigate team. There's a prescriber whose role is really focused on individualized medication treatment and the management and evaluation of side effects from treatment. There's an individual resiliency trainer who focuses on a strengths-based approach and supporting the individual's growth and recovery from that episode of psychosis. There's a supported employment and education specialist who works with the individual to set work and school goals and helps provide that ongoing support to ensure not only that people are connected with the appropriate place to achieve those goals, but that they have the follow-along supports to enable their success as they're starting up with work or school again. There's also a family worker who focuses on the family education program to engage families and provide the kind of education and skills that families need to support their loved one in the midst of experiencing a first episode of psychosis. And then, of course, there's also a case manager. Often that case manager is also the individual resiliency trainer. That role typically gets blended together so that in the case management part, we then are also able to address other social determinants of health, whether that's finances or housing or legal problems or other things that individuals may be struggling with in addition to experiencing an episode of psychosis. So in the original Navigate model, there wasn't a peer support component to it. However, we and many other sites recognize the incredible value of peer support, and many early psychosis services like ours here in the Slate Center have a peer support worker. And so there has been an opportunity to incorporate peer support into that model. So this is sort of a slightly expanded coordinated care for youth and their families. We recognize that sometimes the caregivers or the other sort of important support people in one's life may not necessarily be their family, but could be a partner or other sort of close relationship or caregiver. And certainly there is flexibility within there to be able to incorporate those people, either with family members or even separately for folks who may not have family around. So within Navigate, there are two sort of broad stages. The first is an engagement and stabilization phase that typically lasts 1 to 2 months. The focus there is really on addressing any urgent issues that the individual and their family are dealing with, connecting with the team, building that engagement with all members of the team, and starting to make some progress in treatment. From there, we then sort of move over to the recovery and resiliency phase, and there the focus is really on engaging in depth in the different components of Navigate, helping individuals progress in their sort of identifying the strengths that they bring to the table, setting goals for themselves, building healthy relationships, and also understanding the episode of psychosis that they've gone through and how to not only understand what that means, but also how to prevent that from happening again. At the same time, there's ongoing engagement with our supported employment and education specialists, where the goal is really on making meaningful progress in helping the youth advance in their education and work goals, and then also ensuring that we're continuing to engage with the family through the family education program. As people progress through Navigate, understandably, some people may have subsequent episodes. Part of the early work of Navigate is to help the individual and their family learn about what some of those early warning signs are, how to prevent a relapse or the recurrence of another episode. And the team is able to meet regularly with the individual and the family if they identify that they are having a subsequent episode, to be able to intervene as quickly as possible and help sort of course correct and get people back on that path to recovery. Treatment typically lasts 2 to 3 years, and then at that point people graduate from an early psychosis service. At that point, there's a number of next steps in terms of ongoing care for some individuals. They will go on to be reconnected with their family physician, and the family physician will continue to provide follow-up. And if they needed to reconnect with mental health services in the future, they could certainly do so, but there isn't a sort of urgent need in the moment. For other individuals, they may need to have some low-intensity psychiatric follow-up, and certainly we work with the individual and their family and with the family doctor to get them connected with ongoing mental health supports. And for some other individuals, they may need more sort of intensive supports with case management and a psychiatrist, or sort of ongoing team-based care to continue to support some of the recovery goals and treatment goals that they haven't yet achieved. The Slate Center is a philanthropically funded center that focuses on providing excellent care and advancing research and discovery for youth and their families who are experiencing an early episode of psychosis. The implementation of Navigate has been supported by the Slate Center and by that philanthropic gift, as well as by additional gifts from the Tour family that have helped us advance the way we are able to deliver Navigate, and in particular, being able to move towards digitizing the delivery of Navigate to make it more accessible and interactive.